All right, so we're trying to look at how you can be able to interpret soft tissues on an X-ray film. Interpretation of soft tissues on an X-ray film, right? Things you should be looking out for if you are trying to observe for what soft tissues on an X-ray film. Okay, so we are saying what interpreting soft tissues on an X-ray film actually requires what understanding different tissue. Okay, understanding how these different tissues absorb what X-rays. Okay. Therefore, principles, you are looking at high density tissues. So you are trying to say that these bones they actually absorb X-rays to a greater degree, and they actually appear white on the film. Okay. Therefore, low density tissues, we're saying that air-filled structures like lungs they actually absorb X-rays to a lesser degree. Okay, and they appear black. Okay, then intermediate density tissues, these ones are soft tissues like muscles, fats. Okay, these ones they absorb X-rays to a moderate degree, and they actually appear in shades of gray. Okay, then for soft tissue interpretation for muscle and fat, we say that these tissues actually appear as shades of gray, and the density can vary depending on the amount of fat and the muscle that is present. Okay, then for organs like liver, spleen, the kidneys, and bladder, you can actually be seen as gray areas with varying density. So most of the times, if you want to see them clearly, you now have to apply contrast to it. Okay. Therefore, pathology, if there's any abnormality in soft tissue, such as masses or fluid collection, this can actually alter their appearance on an X-ray. Okay. Then, what are the tips for interpretation? For systemic approach, you examine the X-ray systemically, where you look at each areas for abnormalities. Okay. Then you compare with the normal anatomy. So your knowledge of normal anatomy will help you identify everything that is what unusual or anything that is deviating from the normal. Okay. Then sometimes additional imaging modalities like CT scans or MRI may be needed for a more detailed assessment of those tissues. Okay. So these are the basic things for the principles, then tips, okay, and all of that. So that's it, guys, and bye for now.